Good day, sir. And I'm here to assess your ear, nose, sinus, mouth, and throat. And the purpose of this activity is to help to gather important information about patient state of health. And I will state the every step of the procedure, and I will explain to you the rationale of every step. And I already assembled all my equipment, the tuning fork, pen light, gloves, and black wristwatch. And I already read your chart, and I already performed hand hygiene. And good afternoon, sir. And you are John Polakyal, and I'm Jean Michael Mira. I'm student nurse of Pamantasan Lungsod ng Marikina, and I will provide clients privacy. And I have a few questions of your ear history. And if it is okay if I ask?
Yeah, it's okay.
Do you have any family member ear disease?
Yan.
Do you experience the ear problem or injuries or surgery?
Yan. Wala pa.
Do you any present of ear problem? Itong mga nakaraan, may problema ba?
Wala.
Do you take any medication of ear the last few months?
Wala. Hindi ako gumagamit. Kahit ano.
Okay, it's good. Okay, let's proceed the external ear structure. First, I will inspect your size and color. The normal color of your ear is, it depends of your skin tone. Next, the auricle. I will inspect the color and the symmetry, size of and position. Kung nakalinya ba yung helix mo sa outer canthus mo. And next, the tragus. Next, the lobule. The lobule is, I will inspect the color and size if they have the discoloration and lesion. Next, the external ear canal. I will inspect the size and color if they have the discharge, impacted cerumen, and inflammation. And the child maneuver is to ganito. The child inspect. Okay. Next, I will palpate your helix, and the helix, I will palpate your helix, and the mastoid, it is normal. So, let's proceed the otoscopic examination. So, we don't have the otoscope, but the otoscopic examination, ganito yung gagawin. Inspect the external auditory canal. Next one is the inspect the tympanic membrane. And the last is have the client to perform Valsalva maneuver and observe the center of the tympanic membrane for flutter. Let's proceed the hearing and equilibrium. Assess client respond to normal voice tone. Sir, do you hear me?
Yes.
Do you hear anything bukod sa akin? May narinig pa kayong iba?
Wala naman.
Let's proceed the watch tick test. Sir, can you move here? So, can you hear the tick of watch?
Yes.
And the other one? Can you hear the tick of watch?
Yes.
Okay. Let's proceed to the whisper test. Sir, can you move in the center? Okay. And I will say the word and repeat after me. And sir, can you place your finger in your tragus? Good. Apple.
Mango.
It's normal. Next is I will perform the Weber test. Sir, tell me if you hear in your right or left or both in your ear. Both. Both. You know?
Yes.
It's normal. And let's perform the ring test. Sir, tell me if wala na kayong naririnig, kung wala na kayong naririnig.
Wala na po. Yan, okay na.
Okay. And sir, can you stand up to Robert test? Can you stand up?
What I'm going to do.
Close your feet. And your and close your eyes. And 20 seconds. Okay na.
Okay na?
Okay na. So, it's normal. Hindi naman kayo nagsisway, sir. Okay, let's proceed to the nose. Sir, I have a few question history of your nose. Sir, do you have an allergies?
No.
Do you experience an difficulty of breathing?
No.
Do you have and sinus infection?
None.
Do you have any experience injury of your nose or face?
I didn't experience any of that yet.
Do you experience the nose bleeding?
No.
So, do you take any medication?
No.
Changes in sense of smell?
No, I don't experience that.
Okay, let's proceed to inspect and palpate your nose.
Okay?
External nose. Sir, I will inspect your color and shape. The normal finding in color is it depends in your skin tone. And the shape is yan, ganyan. Pilipino naman tayo, hindi naman tulad ng mga taga-ibang bansa na mga Amerikano na matatangos yung ilong. Kaya tayo ganito lang, swabe lang. Ayan, swabe lang. Thus, I will palpate your nose if is consistency or tenderness. Okay, it's normal and patency of airflow and flaring or discharge the nares. Sir, can you close the right side in your nose? Ayan. Do you have any meron ba kayong nararamdaman na iba o normal lang?
Wala naman.
The other one.
Wala.
Okay.
Okay.
So, let's proceed the inspect of internal nose. First, I will inspect your color of your nose sa loob. And normal naman po, it's color pink. So, and next is I will inspect the swelling. So far, wala naman pong swelling, exudate, and bleeding. So far, wala naman po. And also, I will inspect the ulcer, perforated septum, and polyps. So, mga abnormal findings, mga polyps, wala naman. It's normal. Okay. The nasal passageway. Assess interior structure using nasal speculum. Note nasal septum for position, bleeding or perforation. Mucous membrane for hydration and color. Nasal turbinates for clear and swelling. Okay, let's proceed the sinuses. Sir, do you have any sinuses problem?
Wala naman po.
Okay. I will palpate the tenderness of your sinuses. The first is the frontal sinuses. Sir, masakit po ba?
Hindi naman. Hindi po.
The next is the squeeze sinuses. Sir, masakit?
Hindi po.
Here, sir, masakit.
Hindi po.
Sir, to, sir.
Hindi po.
Wala naman. It's normal. And let's proceed to the mouth, sir. I have a few question history in your mouth, sir. Do you have any mouth problem? Tongue, mouth sores, lesion, gum, redness of mouth, swelling, bleeding, and pain?
None. Wala naman.
Do you have any family history of oral
Wala.
and or chronic problem?
Wala.
Do you daily practice of your oral care, tooth care, and dental care?
I just brush my teeth 3 times a day and that's all.
Do you usually diet?
No, I don't.
History of smoking and alcohol. Do you take any?
No, I don't drink and smoke.
Oh, okay, good. We proceed to the inspection, sir. First, I will inspect your lips, and
Okay.
first I inspect the color. The normal finding is the pink. So it's normal naman. And I will inspect also the moisture, fissure, pigmentation, and ulceration. The abnormal finding. Okay, is normal naman, wala namang kulot. Next is the teeth. Sir, can you yan, the number, I inspect the number and arrangement, sir. And so far, complete. May bungi lang kayo dito. Ayun o. Yeah. Ito so far, it's normal naman. And next, the gingiva. And I will inspect the color. Sir, can you... wag yun ano. Inspect the color. If they have discharge, bleeding, or edema. Kung meron po kayong ano, sir, wala naman. Wala naman. And next, the buccal mucosa. And I will inspect the color and vesicle. Sir, can you vesicle? If they have the vesicle, masses, and ulceration. Next, the pharynx, and sir, and I will inspect if they have the inflammation, exudates, and masses. So far, wala naman. And next, the tongue, the tongue, and I will inspect the position and color. The function is glossopharyngeal nerve and hypoglossal nerve. And next is the salivary gland. I inspect the swelling and redness. Sir, Next is the palates. Sir, can you... Ayun, sorry. Yan. I inspect the color and shape and texture. And okay naman, in the presence of bony prominences. And if it is hard or soft, kung hard ba siya or soft. Next is the uvula. The uvula. I inspect the position, movability, and sir, can you say yan, yan, ayun na yung uvula. Okay. Normal naman. And next, the oropharynx. And we need the tongue depressor. Sir, and the color and texture. Okay, next, let's proceed to the throat. I inspect your throat, sir, and the color. Sir, say And I inspect the color and consistency. Kung bumabalik ba siya. Yan. Very good. And the tonsil, the color of tonsil, or discharge and size. Kung meron discharge and size. Kung normal po ba yung size nung tonsil niya. So far, wala naman. Normal naman yung tonsil niya. Okay. So, I will inform client findings as necessary, wash hands, document findings and reporting significant deviation normal, formulate nursing diagnosis, and formulate nursing intervention. So, that's all. Thank you.